Hello everyone, I am Dr. Karthik K S, surgical oncologist at KMC Hospital Mangaluru. Today we will discuss about cancer journey from its diagnosis till the treatment. So when we start, let us discuss what this cancer is, and we should know what is cancer versus tumor. So there are two things which we already know. Most of the things we discuss what as tumor, that is as a swelling. It can be cancer or benign. So cancer, what it means is it grows beyond control. It can spread to non-local organs. For example, breast cancer can spread to spine, lung or liver. So this is a common example I gave you. So cancer is able to spread, but benign tumors, let us say thyroid tumors, won't spread. But before starting the treatment, we should have a proper evaluation to differentiate between a simple benign tumor versus a cancer malignant tumor. So that is about the cancer versus tumor or cancer and tumor. So let us start with some myths. So myth is like cancer has to be painful. So actually it need not be. It need not be painful to start with. The stage 1 and stage 2 tumor need not be painful, but as it goes into a higher stage, that is stage 3 and stage 4, it can get painful. So people don't wait for it to get painful. Whenever there is a doubt of any cancer or any tumor, go to your doctors. Then cancer cannot be cured. Again, it is not so. When we pick up cancer in stage 1 or 2, the morbidity of the treatment is better or the lesser, and the outcome of the results, the financial burden, everything comes down. So our role and our goal has to be to pick up cancers in stage 1 and stage 2. That is why so many screening protocols. And please, as an awareness, everyone should undergo screening protocols. Then cancer is genetic or familial. It is not so actually. Only 1 to 3% of cancers can be genetic or familial, and it runs in families. We do get common questions or counseling sessions about when girls are getting married, the boys side, the groom side want to know whether her mother's cancer would have been spread to her. No, it is not so. Because when there is a genetic involvement or a familial involvement, it is quite obvious the similar cancers will be running in their families. So such people, any doubts, can take up a genetic counseling or come to an oncologist and discuss about the same. So how do we know when there is cancer? So there are some common red flags which I will be discussing. So let us say about oral cancer. The oral cancer are more common in tobacco users or smokers or tobacco chewers. So such people who already know they are addicts or they use tobacco commonly, if there is any ulceration or any doubtful, please go to your doctor and get it evaluated. Even among the non-smokers, if there is a long-standing ulcer in the mouth, please visit the doctor. Similarly, a thyroid swelling. Thyroid swelling, most often it is benign, it need not be cancer, but it has to be evaluated properly by an endocrinologist or a surgical oncologist to evaluate whether it is a malignant, that is cancerous or non-cancerous. Then about breast. So breast, it presents commonly as tumor or a swelling. Then there are other red flag signs like bleeding in the nipple or recent change in the texture of the areola or the recent change in the shape of the nipple or retraction of the nipple. These are all the red flags in the breast cancer. So it is not about having pain or waiting for it to get pain, because as the cancer advances, it can get painful. Then this other common cancer which can be picked up early is colon or rectal cancers. Most often colon and rectal cancer starts as a bleeding per rectum, or then suddenly there is some change in bowel habits, like a patient who had a normal bowel habit suddenly may have a constipation or a loose stool, alterating of that, or kind of an uncomfortable or the feeling of an incomplete evacuation after passing motion. So these are the red flag sign of a colon cancer. So if there is any bleeder, any bleeding from the colon during passing motion, please get it evaluated. Most of the time these things are misinterpreted as piles. So even before starting the treatment of the piles, it's better to undergo evaluation for colon or a rectal cancer. Then about lung cancer, again, the people who are into smoking are at high risk for lung cancer. So such people, any cough or any sort of doubtfulness has to get evaluated by an oncologist or a physician for any lung cancer. So these are the common cancers I spoke about. to generalize, any long-standing symptoms has to be evaluated properly so we can come to a conclusion. This attitude of being nihilistic or being ignorant doesn't add to the doesn't add to the benefit. It only adds to the burden. So please visit your doctor in the early phase of these problems so it can be evaluated and treated properly. So how do we decide on the treatment of cancers? So firstly, like I already mentioned, it has to be treated after evaluation properly and extensive evaluation. First we have to prove cancers, then we have to prove the stage, then we have to plan the treatment. Surgery is the pivot around which the whole cancer treatment, that is especially in solid tumor. Solid tumor means any tumor which can be operated and removed. So surgery plays a very major role in solid tumor management. But at the same time, we should also decide when the chemotherapy has to be given or when radiation treatment has to be given. For example, in rectal malignancies, in a locally advanced case, it's always better to start with radiation and then chemotherapy and then surgery. So then the outcome will be much better, the survival is much better. This is a simple example I gave you. So there is a lot of science and research about how to start a treatment and the continued treatment. Of course, this whole journey takes some time, effort and lot of support from the caregivers, that's immediate family or friends. So awareness is the key. So awareness about how this treatment can be planned and how the cancers can be diagnosed, and being positive about treatment whenever it can be picked up early and treated properly, the financial burden or a morbidity burden comes down and effective treatment is possible. Then about Indian context, about the cost and effectiveness of treatment. Actually, in India, we are in a very good zone. Like people have all possibility of treatment. People who are financially challenged, government gives lot of support in terms of government schemes. About managing the patients in our hospital, we have a multidisciplinary treatment possible. We have doctors, medical oncologist, hemato-oncologist, pediatric oncologist, surgical oncologist, radiation oncologist. So the support staff, the genetics staff. So we have a multidisciplinary treatment catering to the comprehensive cancer treatment.